Good morning, folks, and welcome to the Palliative Care Friday Chalk Talks. Today we have an episode putting a little bit of a spotlight on the skills of our palliative care social workers, helping our patients with coping skills, and particularly focusing on a recent review article in the American Journal of Hospice and Palliative Medicine on coping skills and fatigue in hematologic malignancies. And to help us with that, we're lucky to be joined by the lead author, Lucy Anderson. Lucy previously worked as a hemonc nurse at MedStar Georgetown University Hospital and currently is a PhD candidate at the University of Pennsylvania School of Nursing. Her research interests include understanding the long-term implications of receiving CAR T-cell therapy. Welcome, Lucy.
Hello, everyone. Thank you so much for having me.
So our format for today is going to be two parts. We've got a short and sweet interview, and we're lucky to have Lucy only until about 10, so we'll be quick, and then hopefully we'll have a minute or two at the end for some questions from the audience. So
great.
We'll start. So in palliative care, we like to start with the question, why? So of all the subjects you could pick, why this one?
Right. So just for a bit of background, my experience before starting the study was in the inpatient setting, doing bone marrow transplants for patients with heme malignancies or, starting that induction chemo. So I just was seeing in the patients, fatigue is this constant problem. We don't really have great tools to address it. And sometimes in that inpatient setting where you're really focused on survival and mitigating, other serious symptoms or side effects, fatigue can kind of be pushed to the side a little bit. There's so many other priorities to get them through their transplant and to remission, hopefully. And so it was kind of always in the back of my mind, but I always felt like I didn't really know how to address it, from a nursing perspective. And it didn't really feel like it was a total priority for clinicians. And then fast forward now with my PhD, I work part-time in an outpatient setting with a variety of different cancer types. And fatigue is, again, like so common, so impactful on patients' lives. And, exercise is something that we can recommend for fatigue. The Oncology Nursing Society recommends that as something to mitigate fatigue. But also, not every patient is able to get up, move around, depending on where they're at with their physical function and where they're at in their illness journey. And so for a review like this, I thought it would be helpful to, explore some other avenues, non-pharmacologic, who with patients that have fatigue that may not want those pharmacologic interventions, may not respond to them, or may not be able to exercise. And so when I did this study, there was not a systematic review that focused on these coping skills in the hematologic malignancy population specifically. There was one on breast cancer, and it kind of had mixed results. And so we were able to pull together about 12 studies using a pretty broad definition of coping skills. But it did allow us to include a variety of different interventions, which I thought was useful because people like different things in their lives, so that was kind of the personal why.
Yeah, I think the literature reflects your observation exactly too, that fatigue is incredibly common and often sometimes missed by us. The next question kind of has three parts, and I'm just going to throw them all on top of you at the same time. So the first one is, what are the main take-home points that are positively supporting the recommendation for coping skills with, fatigue in hematologic malignancy? And the second one is the counterpoint, right? What are the major limitations of this paper? And then three, just kind of putting it all together. What do you support? Are you still a skeptic after taking a look at all of this?
Sure. So I'll start with the positives. And I think I need to be, even with the positives, a little bit tempered. I don't know if we can totally recommend that coping skills work for fatigue. We did see that, there were more positives than negatives when it came to this review, that overall more studies showed significant improvements in fatigue or a trend towards significance than not. And I think another thing that this review showed was that there's a couple different interventions that may work. And so one would be interventions that are problem focused. So this would be interventions like cognitive behavioral therapy, or interventions where you're teaching the patient how to problem solve, where they're able to like identify the stressor and then think about ways that they can actually intervene upon that stressor, as opposed to emotion focus, where you are kind of like acknowledging that there is a stressor and you're trying to just manage your own emotions, but you're not necessarily making any changes to that stressor. So those problem focused interventions seemed to work a little bit better in mitigating or reducing participants' fatigue. And then yoga also seemed to work well. We did include yoga because if they had like a mindfulness or meditation component, we thought that that kind of fit under our really broad definition of coping skills. And so yoga seemed to work well as well. But again, that kind of gets into the point of, well, you know, is that from people kind of using meditation and mindfulness and kind of focusing on coping, or is there some sort of like physical component to there where, you know, they're moving and that's kind of rejuvenating them a little bit. We also saw that individual sessions were more effective than group sessions. And this was done, the review, most of the studies were not during the COVID time period, but we did note that telehealth, like video-based telehealth, seemed to be better at reducing fatigue than just like telephone sessions for those remote studies. So overall, I mean, so fatigue was reduced in 7 of the 12 interventions with a range of effect sizes, but only 4 of those studies reached significance. So I think that there's a lot of positives that also come with coping interventions beyond just reducing fatigue, like improving quality of life, improving self-efficacy. So I think that those are bonuses to introducing these types of interventions. Couple negatives, very few studies were of high quality. Like we really didn't have a lot of randomized controlled trials. A lot were quasi-experimental with low quality methods, you know, small sample sizes, unknown fidelity, or lack of a control group were some big issues. And I think another limitation just of the design of this review that I did was that we included various populations in the heme of, you know, who have heme malignancies, but there's pretty big differences between someone that is a stem cell transplant survivor, you know, 1 year out versus 5 years out compared to a multiple myeloma patient. So I wanted to be inclusive there and include, you know, all those different diseases. But that's definitely a limitation of this study, just for generalization. So, and then I do think that coping skills are, you know, are a viable option for improving someone's quality of life and potentially being able to reduce fatigue. And I think that's a conversation that you have with the patient, you know, what they're interested in and what might work for them.
Yeah, it really mirrors, I think, the literature from most non-pharmacologic interventions for fatigue, where maybe mild to moderate quality studies, kind of some small things, maybe mixed results. They trend positive, but probably are unlikely to be very harmful. One thing when I was reading this paper was why should coping skills help fatigue? Is there a mechanism there? Help us try to make sense of that.
Sure. And this is something that I think about too. And so this is kind of more me just kind of hypothesizing, nothing really official that I've seen.
Sure.
But I think going back to what I said earlier, it kind of depends on the intervention. So for a yoga and mindfulness study, you might have that element of movement or exercise, which can kind of like stimulate the body and maybe reduce that feeling of fatigue and kind of, you know, give someone some energy back. But then for the problem solving interventions, I think that there can be an element of giving people control over a situation. A lot of having a heme malignancy is, you know, very uncertain prognosis. You can relapse, you know, get remission, back into relapse. So I think making people feel like there are things that they can do to reduce this feeling that they have, and being able to control or respond to a symptom can be really empowering for people. And I think that that is, maybe an understated mechanism, for fatigue too.
Yeah, well said. Yeah. Big part of the rationale for most of the non-pharmacologic therapies is because they're unlikely to cause risk or harm.
Mhm.
Did you identify any harm in any of your review?
So there was one instance of someone feeling irritation during an online yoga intervention. This individual, per the report, had splenomegaly. And then actually the next iteration of that study took that feedback, and they specifically included only yoga positions that would not irritate someone with an enlarged spleen. So that's really the only thing that I saw. But I think there's so many other things that have the potential for positive when it comes to coping interventions. Fatigue was often like a secondary endpoint in these studies. So first of all, like some studies concretely measured someone's ability to cope, and that improved in many studies. But also self-efficacy, well-being, physical, emotional, social, the ability to relax or being assertive about your needs. Some other symptoms that I also looked at were anxiety and depression, and those also tended towards improvement. So, there is that one instance, but I think that's avoidable. And maybe if you have someone that has an enlarged spleen, or, maybe is in, has something going on where yoga wouldn't be a great option, then, don't suggest that. But I think for the most part, they're very well tolerated and have positive effects on other aspects of people's lives.
Lovely. So we just have one last question, and then we'll open it up to the audience to see if they've got anything for you. We always like to ask that, sometimes authors discover all sorts of other insights that just don't make it into the paper. Was there any discovery or surprises or something that wasn't published that you want to share with us?
Yeah, I don't think that there's anything that I wasn't able to put into the paper, but I put a little bit of this in the discussion, which is that patients with heme malignancies compared to patients with solid tumors are kind of just less likely to be referred to palliative care in general, and tend to have more aggressive treatment at the end of life, shorter time from hospice until death. So I think that, the lack of great studies or, really rigorous studies in the heme malignancy population for coping skills kind of is part of this broader trend. And I think one of the beautiful things about palliative care and all these different kinds of clinicians working together with our different team members is, that in palliative care, we can look at different evidence-based strategies to minimize symptoms. And so while coping mechanisms may not be right for everyone, they might work really well for certain patients. And so I guess, one of the things that I'm just generally more concerned about, which this study can't really address, but is that patients with heme malignancies aren't always tapped into palliative care like patients with solid tumors are. Sure. But it's, something that I'm thinking about in my future work, and, how to make sure that these kinds of interventions are, approachable to everyone that has, I'm an oncology nurse. So, my focus is on patients with cancer, but really everyone that is having, adverse symptoms that impacts their quality of life.
Yeah. Yeah. So while we open it up for questions and I give people a minute or two to simmer on it, I just wanted to share a quote from an up-to-date article on fatigue and palliative care, with the author being Dr. Bruera. And I really appreciate this. It says, patients suffer considerable distress if there's a gap between the patient's expectation for improved physical function through intervention and the reality of actual decline in function over time. Ultimately, many patients who are terminally ill will become bedridden. And I think so much of what we do is educate, inform, normalize, validate, help them cope with the realities of what's going on. And And this isn't just a skill for palliative care social workers. It's something all of us as clinicians have a chance to do, even if our social workers maybe are a bit more skilled than we are at it. All right. Well, we just have a minute or two more. I don't see any other additional questions in the chat. So I think, Lucy, we will thank you for your time and really
Thank you,
appreciate your
everyone.
article. Absolutely.
I'll put my email in the chat if anyone wants to reach out with any questions or, anything, feel free.
Perfect.
But thank you for having me today. It was great to come and talk about this study.
Absolutely. All right, Lucy, take care. Have a great weekend.
All right, take care. Have a good weekend, everyone.